Medical surgical nursing, questions 81 to 100. 81. The mother of a child with nephrotic syndrome asks why her child must be weighed each morning. The nurse's response should be based on the fact that this is important to determine the A. Nutritional status, B. Water retention, C. Medication doses, D. Blood volume. The answer is B. Water retention. 82. When caring for a patient with hepatic encephalopathy, the nurse may carry out the following orders: give enemas, provide a low-protein diet, and limit physical activities. These measures are performed to A. Minimize edema, B. Decrease portal pressure, C. Reduce hyperkalemia, D. Decrease serum ammonia. The answer is D. Decrease serum ammonia. 83. A patient is to receive 2.5 mg of morphine sulphate. The ampoule contains L000 mg/ml. How much morphine should the nurse administer? At 0.25 ml. B. 1 ml. C. 1.5 ml. D. 2.5 ml. The answer is D. 2.5 ml. 84. When the postoperative patient returns to the surgical unit, the priority is to A. Assess the patient's pain, B. Measure the patient's vital signs, C. Monitor the rate of the 4 infusion, D. Check the physician's postoperative orders. The answer is B. Measure the patient's vital signs. 85. While preparing the midday medications, the nurse finds difficulty reading the label on a medicine bottle. The best action by the nurse is to A. Document that it could not be given due to difficulty in reading the label. B. Make out a new label with clear handwriting using adhesive tape to attach it. C. Ask the pharmacist to replace it with a clearly labeled bottle. D. Give the medication if it is similar to a bottle present on the trolley. The answer is C. Ask the pharmacist to replace it with a clearly labeled bottle. 86. To ensure safe practice during defibrillation, the nurse must A. Cover paddles with electrode gel, B. Avoid touching the patient's bed, C. Remove paddles after the shock, D. Synchronize prior to shock delivery. The answer is B. Avoid touching the patient's bed. 87. The physician orders heparin 40,000 U in 1 liter of D5W4 to infuse at 1,000 U/HR. What is the flow rate in milliliters per hour? A. 250 ml/HR, B. 25 ml/HR, C. 2.5 ml/HR, D. 0.25 ml/HR. The answer is B. 25 ml/HR. 88. What 2 behaviors are important when documenting the depth of the patient's depression? A. Orientation and appearance, B. Helplessness and hopelessness, C. Affect and thought processes, D. Mood and impulse control. The answer is B. Helplessness and hopelessness. 89. The nurse knows that the greatest risk for a patient with a ruptured ectopic pregnancy is A. Hemorrhage leading to hypovolemic shock, B. Strictures and scarring of the fallopian tube, C. Adhesions and scarring from blood in the abdomen, D. Infertility resulting from treatment with a salpingectomy. The answer is A. Hemorrhage leading to hypovolemic shock. 90. The nurse manager has just prepared a medication for a patient and she asked you to give the medication. Which of the following is the best response to the nurse manager's request? A. Give the patient his medication and record it on the chart. B. Ask another nursing colleague to give and record the medication. C. Explain that you cannot give a medication that you did not prepare. D. Give the medication and ask the nurse manager to record it on the chart. The answer is C. Explain that you cannot give a medication that you did not prepare. 91. A patient presents to the emergency department with diminished and thready pulses, hypotension and an increased pulse rate. The patient reports weight loss, lethargy, and decreased urine output. The lab work reveals increased urine-specific gravity. The nurse should suspect A. Renal failure, B. Sepsis, C. Pneumonia, D. Dehydration. The answer is D. Dehydration. 92. A patient is to receive 50 milliliters of fluid in half an hour, 30 minutes. The infusion pump should be set to deliver how many milliliters per hour? A. 25 milliliters per hour, B. 50 milliliters per hour, C. 75 milliliters per hour, D. 100 milliliters per hour. The answer is D. 100 milliliters per hour. 93. A patient with a history of angina pectoris arrives in emergency complaining of headache, visual disturbances and feeling dizzy. Your nursing assessment also notes he looks flushed, is perspiring profusely, and is experiencing palpitations. You should suspect A. An overdose of sublingual nitroglycerin, B. The onset of a myocardial infarction, C. The patient has been over-exercising, D. The beginning of a severe chest infection. The answer is A. An overdose of sublingual nitroglycerin. 94. The purpose of a cardiac pacemaker is to initiate and maintain the heart rate when SA node is unable to do so. B. Stabilize the heart rate when it is above 100 beats per minute. C. Stabilize the heart when the patient has had a heart attack. D. Regulate the heart when the patient is going for open heart surgery. The answer is A. Initiate and maintain the heart rate when SA node is unable to do so. 95. A nurse has been working in a general hospital on the same medical unit for 6 years. The behavioral unit is desperately short-staffed and the nurse is asked to work her shift in this other unit. What would be the expected response of the nurse to this request? A. I will go to the unit and hopefully the behavioral health staff members will assist me with my assignment. B. I cannot go. I have no previous behavioral health experience. I do not want to reduce the quality of patient care. C. I have no previous behavioral health experience. I am willing to go and help with any duties that are similar to those I perform on my unit. D. I should not be expected to float to another unit without a proper orientation. I will fill out an incident report if I am sent there. The answer is C. I have no previous behavioral health experience. I am willing to go and help with any duties that are similar to those I perform on my unit. 96. Order, allopurinol, 450 mg, PO, daily. Drug available allopurinol, 300 mg, scored tablets. Which of the following will you administer? A. 0.5 tablet. B. 1.5 tablets. C. 2 tablets. D. 2.5 tablets. The answer is B. 1.5 tablets. 97. The correct way to trim the toenails of a patient with diabetes is to A. Cut the nails in a curve and then file. B. Cut the nails straight across and then file. C. File the nails straight across and square only. D. File the nails in a curved arch, with low sides only. The answer is C. File the nails straight across and square only. 98. A patient complains of pain in his right arm. The physician orders codeine 45 mg and aspirin 650 mgs every 4 hours, PRN. Each codeine tablet contains 15 mg of codeine and each aspirin tablet contains 325 mg of aspirin. What should the nurse administer? A. 2 codeine tablets and 4 aspirin tablets. B. 4 codeine tablets and 3.5 aspirin tablets. C. 3 codeine tablets and 2 aspirin tablets. D. 3 codeine tablets and 3 aspirin tablets. The answer is C. 3 codeine tablets and 2 aspirin tablets. 99. During the acute phase of a cerebrovascular accident, CVA, the nurse should maintain the patient in which of the following positions? A. Semi-prone with the head of the bed elevated 60 to 90 degrees. B. Lateral, with the head of the bed flat. C. Prone, with the head of the bed flat. D. Supine, with the head of the bed elevated 30 to 45 degrees. The answer is D. Supine, with the head of the bed elevated 30 to 45 degrees. 100. A patient on diuretics has had vomiting and diarrhea for the past 3 days. Which of the following is this patient most at risk for developing? A. Hypokalemia and cardiac arrhythmias. B. Hypercalcemia and polyuria. C. Dehydration and hyperglycemia. D. Hyperalimentation and heart block. The answer is A. Hypokalemia and cardiac arrhythmias.